April is Autism Acceptance Month. It's a shift from the term autism awareness to help foster change and inclusivity for those affected by autism. Joining us right now is a Raleigh mom with an adult son who was diagnosed with autism at the age of 3. Pebble Farrar, welcome to Black Issues Forum.
Thank you for having me, Deborah.
Pebbles, when you first discovered that your child had autism, what kind of support services were available to you, and how did you discover this?
Uh, Definitely, that's a great question because I believe early detection is definitely a strategy in providing the necessary resources to be able to provide mediation and support. So for his age, he was actually under 3 years of age, and it was the early intervention NC infant program that you can go to, and they will help kind of from birth to 3 years of age. They will diagnose the child based off of their developmental milestones and based off of their performance or lack thereof or deficiencies. They will first classify the child as being developmentally delayed. Until they become an age of 10 is when they do the official diagnosis of autism somewhere on the spectrum if they continue to have pervasive symptoms.
Well, as you said, early diagnosis is key. And there's actually some research from the American Journal of Public Health that's shown that Black children are 19% less likely and Hispanic children 65% less likely than white children to be diagnosed with autism. How does managing a son or daughter with autism play out differently, perhaps, for families of color, Pebbles?
Yes, especially I can speak to this with a lot of clarity. Just looking back and reflecting, and for me as a Black mom and my husband, I believe if it wasn't for early detection and just me being aware, now at this time I was an elementary school teacher. And I was trained in early education as well. So I was able to detect the early milestones of when my child was missing those mile markers. So for that awareness, I think that was built in through my educational background, but not everyone has that training. So it's really going to be dependent on if that child is in an early preschool program or they're in uh, early elementary school, and those teachers are detecting difficulties in that child regarding if it's their social behavior, their behavior, or their intellect, or their speech ability to communicate. So for the Hispanics and Black communities, I would see this as being a big concern because oftentimes I think the cultural differences in how we relate and how we communicate and just behaviors and differences between boys and girls may cloud that picture. It's kind of hard to tease it apart, even though autism in itself shouldn't be any different across the multicultural groups or ethnic groups. It presents itself in the same way,
Right,
but
right.
there is a known disparity when it comes to being diagnosed at an early age in those communities.
Well, let me ask you about some of the resources that you found valuable and some that you appear to be creating yourself to help other families who have children with autism.
Yeah, so definitely I had to really go within deep. First, you're looking for resources to outsource. You're looking for speech, you're looking for behavioral therapists, you're looking for day centers or programs that are going to provide the intellectual stimulation. Of course, you have the public school system. You can go through, get an IEP, individual education plan, through the special education department. You can go through the Medicaid, the state way, and try to get additional funding through their innovation waiver program, which has a long waiting list. Requires different testing to be done, and oftentimes the slots are just not available. There are children who are waiting up to 7 years to get some of these services. So when I start noticing that there was a communication delay within the system, I had to start being innovative myself. So I start leaning on my religious community, my church family. My children went there. They were able to get the socialization. They were able to get the behavior. The children there were inclusive. They included him in the participation of activities. I relied on my family. I communicated the needs that I have as a mom. I had friends. I had their children. We always created opportunities for play dates and times for social. So to really submerge him in those environments, I used to get behind him and help him to play functionally if it was building blocks in the
That's great.
sand pit.
And you know,
Um,
Pebbles, I think that all of the things that you've outlined that you've done, I would imagine other parents can borrow from that, as well as some of the resources that you mentioned. And I appreciate you sharing that information once again.
mhm.
Pebbles Farrar, thank you for joining us.
Thank you.